Osteoarthritis is completely curable. The first myth: osteoarthritis can be cured. Unfortunately, this one has an uncomfortable truth. Osteoarthritis is, in fact, not curable in the sense of restoring the joint to its original, brand-new condition. There is no miracle pill that you take once and it magically repairs the joint from the inside, making it perfectly healthy again. That simply doesn't happen. Osteoarthritis is a chronic condition. So why call it a myth? Because although it cannot be reversed entirely, modern treatment approaches allow you to preserve your joint, live comfortably, and slow down its progression significantly. Let's talk about the so-called magic supplements, chondroitin and glucosamine, often referred to as chondroital protectors. They do not rebuild cartilage. The word protector means support. Think of them as additional lubrication. Movements may feel smoother, and ligaments may function more comfortably. Some doctors or critics may argue that research questions their effectiveness. However, if you look at sports nutrition stores, you'll see these supplements widely used. Many athletes take them and report reduced ligament discomfort and improved mobility, not because they were tricked, but because they feel a benefit. They are not a cure, but they can be supportive. Taking them generally won't harm you, but expectations should be realistic. What truly helps? Exercise and muscle strengthening around the knee. Strong muscles stabilize the joint, improve biomechanics, and enhance blood supply. Movement. Joint fluid is produced during motion. The more appropriate movement you have, the better lubrication the joint receives. Managing pain and swelling when necessary. This allows you to stay active instead of avoiding movement. The key point: if you exercise properly, you can slow progression and maintain mobility.
Osteoarthritis only affects older people. It is more common with age, yes. Like any mechanical structure, joints wear down over time. But osteoarthritis can develop earlier due to genetic predisposition, developmental issues such as joint dysplasia, injuries that alter joint biomechanics, post-traumatic osteoarthritis. No matter your age, prevention and muscle strengthening remain essential.
Osteoarthritis always causes pain. Not necessarily. Especially in early stages, 1 to 2, discomfort may come from muscles or surrounding tissues rather than the joint cartilage itself. If you notice crunching sounds, stiffness, reduced mobility, or unusual sensations in your knee, get imaging done, such as an X-ray. Early detection makes management far easier. It's better to address stage 1 than to discover stage 3 when surgery becomes more likely.
Only surgery can help. Joint replacement is not automatically required. In stages 1 and 2, surgery is rarely indicated. Replacement is considered when pain is severe, walking becomes extremely difficult, mobility is significantly limited, the disease reaches stage 3 or 4. Consult an orthopedic surgeon if necessary, ideally more than one for different opinions. Surgery is not the enemy, but timing matters. It should be done when appropriate, not too early and not too late. Delaying too long can lead to muscle atrophy and ligament shortening, which make recovery harder. Additionally, certain age-related medical conditions may eventually prevent surgery.
Excess weight doesn't affect the joints. It absolutely does. Every extra kilogram adds significant load to the knees. Weight reduction can dramatically reduce stress on the joints.
Walking is harmful if you have osteoarthritis. Walking is not forbidden. In fact, it can be beneficial, but it should be supported by strong muscles. The correct sequence is 1. Strengthen the muscles first. 2. Gradually increase walking activity.
About physical therapy, exercise therapy. During flare-ups with swelling and significant pain, activity should be modified, not eliminated. Gentle movement improves blood circulation and nutrient flow while reducing stagnation. Once the acute phase passes, begin structured exercises: bending, straightening, lifting, controlled movements. However, basic mobility exercises alone are not enough long-term. After several months, you should add strength training. Muscles do not grow from simple leg lifts alone. They require progressive resistance, elastic bands, light weights, supported squats with controlled range of motion. And remember, don't focus only on the knee. Train the hips, lower back, and overall body stability. A strong body protects the joints. I hope this helps clarify misconceptions. Early stages are not a reason to panic. They are a reason to act. If you've only been doing light exercises, consider progressing to strengthening work gradually and safely. Take care of your joints, stay active, and stay healthy.